Hi, my name is Abby Labari. I'm going to be talking about risk management process for my informatics class 645. It's my risk management class 645. There are 4 process steps for risk management. 1, identification and qualification of an inherent risk. Decision making regarding the most appropriate form of risk treatment for the risk identified. Application of suitable controls to achieve the objective that we determine. Acceptance of any residual risk following the implementation of the controls applied. My scenario is an inherent risk. Identifying the risk actually is what can happen, how and why it can happen, what is the likelihood of it happening, and what will be the consequences if it does happen. So my scenario is a patient walking into a lab to get his blood drawn. What can happen? Several things can happen with the patient coming in to get their blood drawn. The patient can develop a hematoma after their blood has been drawn. How and why would this happen? If the patient was a heart sticker or the patient was being poked more than once, it can eventually develop into a hematoma. What is the likelihood of this happening? It happens majority of the time because, like I said, if he's a heart sticker or the rep was having issues taking his blood or was using the wrong needle to draw the blood, what would be the consequences? The consequences will be, well, the patient will get an hematoma, and the consequences will be that the facility will have to take care of the reaction, whatever happens next, if the patient needed to be treated or if the patient needs to be monitored or watched, because a hematoma can result in surgery sometimes. Analyzing the risk. Well, I have identified the risk, a patient getting a hematoma. So in analyzing the risk, we want to know how the patient got the hematoma. Was it because he was being poked multiple times? Was it because the patient was using a straight needle versus a butterfly needle? So if the patient was being stuck with a straight needle and that was what was causing for the hematoma, then our treatment would be that patient's blood should be drawn using a butterfly needle. We will have a sign out the door of the lab stating that all blood will be drawn using a butterfly needle in order to reduce risk. And then once the patient comes to the seats to get their blood drawn, we will also let them know that today's procedure will be performed using a butterfly needle. And also, after 1 or 2 sticks by the lab technicians, and if the patient's blood is not being, if they can't get the blood, then we will have to have the nurse practitioner or the physician draw the blood themselves. So that would be the treatment for the risk. We have identified the risk as patient getting an hematoma after the blood has been drawn, analyzing the risk that the reason why they got an hematoma was because they were being stuck with a straight needle versus a butterfly needle. We had treated the scenario with having our patient's blood being drawn by butterflies rather than straight needles. And in conclusion, what would be the facility's decision if this does happen, if the patient still got an hematoma? Well, we will have to reevaluate our treatment plan again, and any reaction that they do get after still using our butterfly, the facility will have to take care of the cost in order to avoid a lawsuit. Recently, there's been cases where a lot of injuries have occurred through phlebotomy, their blood being drawn. In In conclusion, it is the responsibility of the facility to develop a risk plan or risk management process and adhere to it, and revise the risk plan or process that they have in place from time to time. And that concludes my video for information 645 today. Thank you. Bye.